Hello everyone, my name is Katina Gilles. I am a float registered nurse. I have been a registered nurse for 3 months. But before that, I was an LPN for almost 3 years. I was working as an LPN in short term and long term rehab through staffing agency. I decided to try float nurse as a new grad. So far, I have worked on the post-op, oncology, triage, ED border, step-down unit, and on the postpartum unit. As nurses, we have to understand the care coordination and integrate it into our profession. This is my care coordination presentation. In this presentation, I will be discussing the role of the registered nurse in care coordination and factors that impact care coordination. I will also focus on how healthcare policies affect patient-centered care and the benefit of collaboration between nurses and doctors. To begin this presentation, let us define what care coordination is. Care coordination synchronizes the delivery of patients' health care from multiple providers and specialists, according to Hannigan. Care coordination has been in the healthcare system for decades and is a great tool to care for patients with chronic diseases. Through care coordination, nurses provide safe, effective, and high quality care to patients and their family. It is essential for patients with chronic health disease such as diabetes, stroke, high cholesterol, hypertension to receive care coordination. Through care coordination, providers and specialists work with the patient to receive high quality care while reducing medical costs and ensuring patients' needs are met. Nurse coordinators perform different activities during the day for the patients. Each patient care plan is different and require specific goals. Nurse coordinator will update care plan as necessary if possible goals are not actually met. According to Hannigan, the delivery of each patient's health needs is synchronizing with multiple providers or specialists involving in the patient's care. Providers and specialists will work together to provide the highest quality of care while reducing unnecessary healthcare related costs. They treat the patient and preventing worsening of the condition of readmission for the same problem. Nurses play many roles in care coordination. One of the main roles is to assess and create a care plan to help patients achieve optimal health. Nurses collaborate with doctors and specialists to organize treatment plan and manage the patient's condition. They work as a liaison between the patient and their healthcare providers. As a nurse care coordinator, nurses are the managers of provision of care through which they advocate for the patient. They keep track of the patient's health, create and review their care plan while involving the patient. It is important to include the patient in their care plan. The nurse coordinator educates the patient about their illness and monitor their response to the illness treatment. As previously mentioned, care coordination is a health process that requires collaboration between an interdisciplinary care plan. From nurses, doctors, specialists, and patients, it is essential to collaborate to attain optimal health. Patients and their family are very important to include in healthcare. Healthcare researchers have identified several strategies for interdisciplinary teams to provide quality care and achieve desired patient outcome. Collaborate with patient and family to achieve desired outcome requires shared decision making and involving patients in their care plan. Nurses have to be open and be honest with the patient and their family regarding their care. In this article, strategies for engaging patients and families in collaborative care plan programs for depression and anxiety disorders. Researchers believe that several strategies such as behavioral changes, personalized care planning, shared decision making, patient education, and self management were used to evaluate patients' outcome. Patient education and self management were the most used strategies. Now, it is evident that patient education is very important to achieve desired outcome. Nurses should use simple language when talking to the patient. Consider any communication barriers that should be addressed. Communication barriers such as language, pain, comfort. Patients who are having pain is not ready to learn. Nurses can provide a professional medical trained interpreter that can relay information or interpret to the patient in their primary language and culture. Patient education should be done when the patient is not tired, in pain, or having any sort of anxiety. Researchers identified that having a nurse care coordinator in all care facilities, including hospitals, greatly reduce emergency visits and increase patient satisfaction. The nurse care coordinator demonstrated the value of nursing care by reducing inpatient and emergency visits and increasing outpatient visits. To reduce inpatient and emergency visits, the nurse should assess patient needs and goals and follow up when needed. It is important to reassess the patient condition to prevent deterioration, which would bring the patient back to the emergency room. Nurses and providers engage patients in their care coordination plan. Sometimes they educate the patient on their health and require follow-up as necessary. For example, a patient who suffered from diabetes might need to modify his diet and follow up with a dietitian. The nurse coordinator or the doctors might make a referral and encourage the patient to see the dietitian. The patient then forgot all about what the doctor said and returned without modifying his diet. And his A1C has increased. This is when change management is essential and should be implemented. Involving the patient in their care plan brings better outcomes rather than dictating them on what to do. The healthcare providers can support, advise, encourage, and inform the patient about the illness, but it should always be up to the patient to make decisions about their own treatment. In the ANA Code of Ethics, there are 9 provisions. Provision 1 says nurses must practice with compassion and respect. Nurses establishes relationship of trust and provide nursing services according to need, setting aside any bias or prejudice. In the ANA Code of Ethics, nurses was provided with a set of ethics to assist them with ethical concerns. There are 4 primary principles that nurses must follow to ensure patient safety. The 4 primary principles are non-maleficence, autonomy, beneficence, and justice. Ethical decision allowing nurses to care for patients, ensuring no harm is done to the patient while allowing the patient to make their own decision, which is autonomy. The ethical decision making and care coordination is very important as it allows nurses to set aside bias or prejudice and care for all patients regardless of their background or culture. In conclusion, nurses play an important role in care coordination in the healthcare system. When nurses and other healthcare providers put patients in control of their care plan, it results in better patient outcome. Nurses should be competent and aware of code of ethic and healthcare policies that can affect care coordination. Nurses must consider the needs of each patient and let them be in complete control of their care. Nurses must apply the code in coordination of care to ensure patient needs are met. Practicing justice also will make sure all patients are cared for fairly and equally.